Good morning, y'all. It's Friday at 6 in the doggone morning. Hope everyone had a good night's rest, because I only got about 3.5, 4 hours sleep. So I'm about to take my husband's grandson to, when I say I'm 38 hot, y'all, I'm 38 hot. So he has this GED test. He has to be there at 7:15. But then he has the audacity to say he smoked something that he had no business smoking on the way to our house on the bus. So I'm like, we gotta go to Walmart. My husband says to go get something for his system for this drug test. I said, why are we even doing that? Because that was one thing my dad said: if you still into doing drugs, I'm not finna help you, period. So I'm sitting in the car like, okay, well, you ready? And he done walked off smoking a cigarette outside our house. What the heck? So my husband talking to him like, we spending money on you to take a test and to go get something to clean out your system for something that you done did. That's stupid. And he ain't took the trash out to the road. So I'm like, what the heck? I done got woke up for this mess? Hold on. Then he just still was standing there, and he was like, I'm not taking you. Cheryl is taking you. And then I'm like, well, he ain't even took the doggone trash cans to the road. But I gotta get up at 6 o'clock to go walk you in Walmart to go get some mess that, y'all, when I tell you I'm pissed off, don't nobody else need to call our house to ask for nothing. He just sit in the back seat, period. Because I don't like cigarette smoke, and I think it was a Black and Mild, because those are very distinctive. How you smoking and you 18? You just turned 18. I don't even know how I guess you get cigarettes at 18. But when did you get a cigarette? Like, who buying stuff for you before you, because you just turned 18 on the 14th. Y'all, when I tell you, I'm livid. Livid. Over it. I'll come back, y'all. Sorry. Hey, guys. So, home back in the bed. I had some honey bunches of oats with almond milk. It's not or the almond milk's on my diet, but the other's not. But like, I just ate a small amount to take my lupus pills, my Celcept, and I just took a Fiorcept for migraine. My head, like I said, this is day 2 with my head hurting, and the light's killing me right now, but I don't want to get up to turn the other light on. I have a doctor's appointment at 2:45 with the pain doctor. They called me yesterday and said I needed to come in now to get a script, which I'm kind of ticked off about, because they told me this doctor could write the script for a month's supply, and then I go see the other doctor on the 26th. So now I have to go in, pay 20% to see this doctor, then go back on the 26th to see the other partner, because that other partner is the one that did my injection that I have to follow up on because it didn't work, and I'm in so much pain that it's ridiculous. So I'm like really, really pissed off right now when it comes to this, because 20% adds up. So I'm like over it at this point. So I'll take you guys along to see what the heck they gotta do. So talk to you guys later. Hey everyone. Turn the air down. It is hot. It's 82 degrees. Jesus. I'm rocking my Alabama hat today because my hair is a mess. And this is the first day that I have worn my ponytail out. I forgot earrings. I forgot my wedding ring. I slept until 1 o'clock. Because when I take my migraine medicine, it knocks me out. So I was able to at least get some rest with that. And I'm headed to my doctor's appointment. I'm trying to think which way is the quickest at this time of day. So I'll just take the interstate. So I'm tired, as always. I'm still in a funk of a mood.
Hello,
Hey,
good afternoon.
how are you?
Doing well, how are you doing? Dr. Mullen, nice to meet you. Sorry about last Tuesday, I understand you had an appointment.
Yeah.
And things kind of got canceled at the last minute, and I saw you were trying to get in, so I tried to work you in the best I could today. So you had a procedure, you're welcome, but you had a procedure on the 16th of January for the SI joints, and that didn't give you any relief at all?
No.
Okay.
And normally it does. Like when Dr. Terry does it, it's good for like 6 to 7 months.
Okay.
So I don't know. She was wanting to do an MRI and stuff beforehand, but I was like, oh, let's just try the SI joint, and I thought it would be okay. But
when was your last MRI of your back done? Let's see here.
I don't know if she did one when she first came. It might have been before she came. When I was with Dr. Harris. I'm not.
Looks like 2016, so we weren't here yet.
Yeah.
She and I started right about the same time. Yeah. So you're fused at L5S1. So those joints shouldn't be giving us trouble. L45 might give us some trouble. When was that fusion done at L5S1?
2012.
Is your pain worse on one side than another?
The right is worse.
Right. Okay. Did I do a nerve study on you by any chance? Okay.
Yeah.
And when do you notice your pain? Is it worse like when you twist, turn, bend?
All of it. It's no particular. I mean, bending, of course, is worse. But even like breathing at this point, my back hurts. But I'm kind of in my flare time because I get my infusion next week for my lupus. So.
And you've been off the amitriptyline because of the flu too?
Yeah.
Do you have the flu?
I had it a week ago, so I'm off. But anytime I'm out, I just put my mask on because I don't want it again.
You can get it again too.
Yeah.
Go ahead and stand up. I can see you're an Auburn fan.
Never.
Take a look at your back here, and just turn to the left for me. And move your legs too.
Sorry.
That's okay. So if I'm going to push right about here, do you get pain right in that area?
Yep. And it's worse on the right.
Worse on the right side? So this is L4 right there. If I have you lean back into the right side, does it get worse? Okay. Is it right about there where it hurts?
It kind of goes to like right in here.
Okay. Does it hurt down in here too?
Yeah, it's sore. Because my hip's still, and it hurts like up in here.
Up here, okay.
Yeah.
So I'm sorry for pushing. It's probably going to hurt more when you drive home. Curse my name, but that's okay. Does that hurt kind of right over there?
Yeah.
My suspicion, is that kind of where it hurts the most if I push versus here or here?
It's really tender, all of those spots.
All of those spots.
Yeah.
Your SI joints are in this area here and here. And I know Dr. Gray, and he hit that SI joint for certain. Go ahead and have a seat here. He's very particular.
The medicine it stayed numb for, like it just really kind of like let up with the numbness, and I was like, oh, that's different.
Go ahead and bend forward, touch your knees, or touch your chin down to your chest. And you can bend forward a little bit more too. Does that cause any pain going down the leg?
The back part, like mostly like right in here.
Okay.
And I'll get like sharp muscle spasms in this thigh, like out of the blue. So
go ahead and lean forward on this side. Anything there?
It hurts a little bit, but not anything like this side.
Okay. What I want to do, I think it'd be reasonable to get a new MRI of your back.
Okay.
My suspicion is you probably have your sacroiliac joints are probably not. If you've had good response in the past, they're probably flared up too. But these little joints, you're fused at L5S1, so you're fused here. These little joints that take movement, they're called the facet joints, are going to have to make up for the lack of movement in L5S1. So the next level up is L45. When I examine people, I put my fingers over top of the what we call the pelvic brim. Think of your pelvis is like a bowl. And I bring my thumb over, and my thumb is actually sitting right on L4 right here.
Okay.
I come over about a finger breadth over, and I push. That's right over top of that facet joint.
Okay.
And my suspicion is you may have some irritation of that facet joint, maybe even a little wear and tear arthritis. So what I'd like to do is get a new MRI to kind of confirm that, and if we need to, talk about a procedure to try to knock out some of the pain related to that.
Okay.
All right?
And I never had a bone density scan, but I went through menopause in my 20s.
Okay.
So is that something good to have?
Do you have a history of osteoporosis in your family?
My mom did.
How old was she when she got it?
She was 55 when she died. But she had stroke. She had kyphopathies, like from compression, like they just kept happening. But she was on a lot of prednisone too, so.
Yeah, I mean you're pretty young.
Because Dr. Harris said he felt like I had ankylosing spondylolisthesis. But then Dr. Brown was like, "Oh no, you don't have that," and I'm like, "Cool, I don't know who to believe anymore."
Well, if you ask us all, we all have our own opinion, and we all think. Who's your insurer?
Medicare.
Medicare. I'd have to look into whether or not we can even get a DEXA approved.
Okay.
I mean, Medicare kind of retrospectively looks at things, but I want to make sure that if we're going to do that, we get.
Yeah.
You're not going to get hit with a bill, or somebody else gets hit with a bill. But,
Yeah.
Day after Christmas birthday. That's a shame.
Not bad. I still get gifts.
You still get pretty good. Yeah, but it's better to have it like spaced out. You know, you get a lot more. But at least everybody's always together for your birthday.
That's true.
That's a bonus. Let's see. We're gonna go ahead and do an MRI of your lumbar spine and your pelvis because you're gonna be in the scanner anyway.
Okay.
That way, if we decide that maybe we want to do nerve blocks for the SI joints, we can do that down the road.
Okay.
If we decide we need to do L4-5, we'll have those done.
Okay.
And then we'll get you the refill. 120 tablets last you a couple months, is that right?
Yeah, this one was filled in November 14th.
Oh, well, you actually still have some too.
Yeah,
Okay.
like at the 8th. So she did that when I was in like such a horrible flare because I was like off of my lupus meds for like 3 months for an infection. So things were like haywire. But I never would take it like she told me to because like I was on really strong stuff when I was with Dr. Harris. Like, what was he? Dilaudid.
Okay.
And I weaned myself off because I felt like it was hurting me more than helping me. And I was on oxygen for a year and a half. So it was like, no, I'm just going to wean myself off.
Did you come off Dilaudid and oxygen afterwards? Or? Wow.
I came off the oxygen, but I don't know if it was related with that or my lupus or both, or I don't know. So she always said, I can move it up, or, you know, we did do Percocet for a while for breakthrough pain, but I'm like stubborn and I just don't want to take it.
When do you think you're going to get back onto the amitriptyline?
I can start it back.
Do you think it was helping you, or do you notice a difference?
It helps, but like when I go up to the 30, like I was taking like only the 30 milligrams, I would have kidney pain and like urinary issues. So I would back down. So the last time I took it, I think I was only doing 20.
Okay.
So I'll start it back and see how it does.
If the 20 works, you don't have to go higher than that. Do you need any more baclofen?
She did refills, I believe, on both amitriptyline and that one.
She had a caudal epidural, which didn't help.
And I told her, when she did it, like I immediately left town and we took our track club to Michigan and we drove. So that's why I think that didn't work because I was not able to really like rest like I needed to. But
it should, no matter what you do, the steroids should take effect. It should help. But in T10 and 11 intercostal nerve blocks, an SI joint injection, you had an L4-5. And you had a placement of a spinal cord stimulator.
Mm-hmm.
Do you have a spinal cord stimulator in now? Or is it, no?
I took it out.
Okay.
It worked when they did the trial, you know, and I was like, oh yeah, this is gonna be good. But once they put it actually in, it was horrible. Yeah.
Yeah, I think this is the next best step here, is to get some more imaging and determine what we need to do next. Right?
Alrighty.
You have a secondary insurance too, or?
Oh, I'm stuck with a 20%.
Actually, Christina's our practice manager. I know she's been here long enough. She'll probably be able to tell us.
Okay.
All right. It's nice meeting you. Let me go ahead and get your script for you, okay?
Thanks.
Just hang tight.
Alright guys, so I'm done. I did record, but he's kind of soft spoken, so I don't know how much you can hear, but I'll play with it whenever I get to editing it. But he is concerned about my L45, because I had the fusion done on the L5S1, and he said he's really not concerned about that, but when he's pressing, the pain that I'm having is L45, so I have to have a new MRI because I haven't had one on my back since 2016. My doctor wanted to do one before she left for maternity leave, but I was like, oh no, let's just do the SI joint and I should be good, and I'm not good. It's just getting worse. He refilled my meds. He apologized he's super sweet. He came in and he introduced himself, so he forgot he did my nerve study. Then he asked me, like, hey, did I do your nerve conduction? And I was like, yes, you did. But he is super, super sweet. And he was just like, I just want to see you back in 3 weeks, so I don't have to go to the other doctor on the 26th, which I'm happy, because, you know, I was going to be hot to have to pay 2 co-pays or whatever. But, yeah, so they're going to schedule me. I go back to see him in 3 weeks and go over the results. And he said that way he can look at it to know exactly what kind of treatment or injection that I need. My doctor should be back the first part of April, so more than likely I will have it with her. I'm not saying this doctor wouldn't be good, but I mean, I like the other guy. He seemed nice, but I guess it's not his fault because it didn't work. And I just told him, like, I really feel worse than I did prior. And it's always hard to tell, like, is my pain gonna get better just because, you know, is it because I'm in a flare at the moment or what? So I don't know. So yeah, almost 5 o'clock traffic, and it's bumper to flipping bumper.